At this point, I'm going to turn the presentation over to Dan. Take it away.
Thanks, Jen. Really appreciate it. So thanks, everyone, for joining. We're really excited about this, this webinar and this text. We presented, I guess it was like 6 months ago or maybe a little bit more about this and had really great reviews, and we're excited to share again this labor of love that we've created to advance the profession of nursing as well as healthcare in general. So we've done the background, so we probably can skip past this slide, but Sandra and I are the lead authors on this project, and we're really excited to bring you a text that combines our passions for leadership, innovation, and change and evidence-based practice. There's no text like this out there yet. There's texts that highlight innovation, highlight evidence-based practice, and highlight leadership, but this is something that brings those three concepts together and guides us in how we can build the future leaders in healthcare. Our amazing mentors and co-conspirators on this text are also not able to join us on the line, but will give us their full support. I think Kathy's actually in Venice right now on the canals, she said, so she can't make it. But Tim Porter O'Grady and Kathy Malik have supported us on this. They've written several chapters in this book, and it's from their vision of innovation and evidence-based practice that this book was born out of. So we want to just thank them for their amazing contributions and mentorship as we've built this text together. So this book really was written because both Sandra and I, Tim and Kathy, have all taught in leadership programs, DNP programs, done consulting out in the real world, and found that there's no text that combines the concepts we were trying to teach in a way that linked it all together. And so this text was born from the need to link leadership, evidence-based practice, and innovation together as a dynamic to move healthcare forward. We were fortunate enough to have Maureen Bisignano write the foreword, and the foreword is, the theme of the foreword is really, and is the new or. And what that means is it's not evidence-based practice or innovation. It's evidence-based practice and innovation. And similar to what we find in hospital systems, usually there's a performance improvement team or an innovation team, and they work on separate projects but never together. And what we're seeing in the industry as they mature towards continuous improvement into more mature leadership structures, into magnet and shared governance structures, that there is no or anymore. The only way our complex systems can move forward is with and. And so it's performance improvement and innovation, evidence and leadership. And so it's a great kickoff to the theme of this book because it is interconnected complex systems. And so if you take anything away, it's innovation building upon evidence, evidence as the foundation for us to lead into the unknown. So we know there's several trends influencing leadership that we needed to address. One, we're seeing a huge increase in emerging technology and consumerism in changing healthcare interactions. Our patients, or as at Kaiser Permanente we call them members, so you may hear me say members, but our patients are expecting different experiences. They're coming with phones with more knowledge than our physicians and nurses can keep in their brains. They have done more in-depth investigation on their diseases, and in some cases may know more about treatment patterns than our clinicians. And so we have to change the way we practice to engage in that dynamic. And we know leaders are not prepared to connect the rigor of evidence and the emergence of innovation solutions. Many times it's easy to pick well, this unit's doing well, so we're just going to adopt that, instead of looking at what can we do differently or building on the nuances of a different culture. And so we have to have leaders that are able to take ambiguity and translate it into evidence, and when the evidence isn't strong enough to suggest a robust solution, to be able to create those solutions and measure them on the back end, and that's what innovation is. And so we need leaders that can do that. We also know there's an increased focus, or the only focus it seems like now, is on value-based healthcare. The volume side is quickly going away as physician groups are being bought out and accountable care organizations are developing. But we need to have leaders that understand that value-based equation. It's about patient experience. It's about nursing satisfaction. It's about HCAP scores. And it's about deeper levels of understanding and caring and innovation and technology. And we have to connect all those dots together in order for us to be able to lead healthcare in a new direction and change our healthcare structures. We also know that performance improvement teams are combining with innovation teams. Now, if you look at their methodologies, they're on polar opposite ends. Performance improvement is all about reducing outliers, finding the solution with a certain number of standard deviations, and innovation is all about finding the outliers, pulling on them, and understanding what they do differently. And so the methodologies are different, but they're complementary if you combine them when you solve really big, complex problems. You want to reduce outliers in some situations, and you want to find them in others. For example, if you're looking at building a new clinic, you want to take the best structures of a clinic, the best practices that are working to manage large populations, but you also want to look at what designs break us out of that sterile hospital environment. And so those are things that we need to connect with and understand, combining both performance improvement and innovation. And finally, the leaders need new competencies to understand the rigor of evidence and link it to the science of innovation. There's actually science and practices related to innovation that we need to understand. Design thinking is one, and there's several others. So what is evidence-based innovation? Well, evidence-based innovation is really the relationship between evidence and innovation. And that sounds simple, but it's very complex. Usually we find that people are in one camp or the other. They're like, we only do evidence-based practice, and if there's no evidence, we can't do it. Or we find people that say, well, you know, you can find evidence on anything, and so we kind of disregard it, and we're going to go find the newest, shiniest object. But if you combine the two, they're actually very complementary. It's the foundation of knowledge and experience. It's taking what we know about something in evidence, in research, in our experiential practice, and the rigors of evidence-based practice, and using that as a foundation to build upon. So we're not recreating the wheel, but we're able to have a solid foundation to jump and try new things above and beyond. You know, we have evidence that, you know, you may control blood pressure with certain medications and modalities, but we're also finding there's innovation in longitudinal tracking using wearable technology to understand blood pressure ranges differently. So if you know what baseline blood pressures are from our evidence and the treatment for those, but now have new sources of data from innovation and technology that allows us to see a blood pressure over weeks and months on a minute-by-minute basis, we have new insights into what happens physiologically, what happens with medication treatment, and nowhere in the evidence is that shown. And so we have to have leaders that are able to interpret that real-time data, those real-time changes upon the back of evidence to say, what if, and ask the questions and try things out so they can build future research projects or even just pilots and tests of change in the world. And we have to be able to adjust practice. We know that if you can't adapt, you die. And so we have to understand, how do we adapt practice? As care moves outside of the hospital walls and into the home, we need innovative leaders to understand how we change nursing and healthcare education, how we structure our organizations, how we deliver care remotely into the rural areas without being able to get there physically. Those are all things that are unknown, that the evidence is not built enough for us to make solid decisions on. And so we need leaders that go out and try new things on the back of foundational science so we can understand and build the future of healthcare, because it is unknown, and we need leaders that are okay with that. So you can see here that it's the innovation process is generative, dynamic, emergent, changing. And evidence-based innovation is actually the combination of that generative process of innovation on the solid factual foundations of EBP, deep study, science, and it's the combination of those two allow us to adapt and change founded on the back of deep understanding. So why is it important for us to write this? It's important because no other text combines the critical leadership concepts of evidence-based practice and innovation. There's no other one. And so we had to write this book because we are teaching this to our leadership students in University of Alberta, at Ohio State University, where we're teaching this content, and we needed something that we could teach from instead of having students buy 15 books and trying to connect chapters together. So we tried to combine this. We also knew that there were bright spots out in the world of people doing this work already, and so this text allowed us to bring those bright spots in and showcase them. One is, and you'll hear about this in a little bit, but one is with Kaiser Permanente and how we're innovating with labor union relationships to create new practice models and implement new technologies. Another one is from Cincinnati Children's on how they built a business case to change practice from a leadership perspective. So this is real world work connecting back to theory and the practices that we are teaching. And healthcare organizations are demanding a competency in both innovation and evidence. And I find this in my organization now. We're combining performance improvement and innovation together on a single team. And we need leaders that understand both methodologies in order to solve these huge issues within healthcare. And so it takes a different mindset. And so we needed a text that could help build leaders that were able to take that context forward. So quickly just about this text, it is 16 chapters. That was intentional because most programs are between 14 and 15 weeks. So this will allow you to assign about a chapter a week. It also allows a final wrap-up chapter that summarizes it all together and pushes us forward towards what we think the future of healthcare innovation, leadership, and evidence-based practice will be. Like I mentioned, it's written by industry leaders who are embedded in organizations and research. This isn't a large group of people that haven't practiced for a while writing a book. This is people doing consulting, leading large organizations, actually down into the front lines of healthcare, and writing about their experiences and linking it back to the science of complexity, the practices of evidence-based practice. We cover some of the emerging topics that haven't been hit on in our traditional text, like informatics, how informatics and real-time information is impacting decision-making, how technology and big data, wearable technology, and those type of things are impacting our leadership and our decision-making at a managerial and leadership level. We were founded in complex systems and the research around that. And we're also linking in the latest in innovation research, both in healthcare and in the business world, to understand how we can move complex systems forward in complex organizations. We also wrote this with the faculty in mind because we're teaching faculty, and so we want to make this easy. We understand how hard it is to adopt a new book and create assignments and build courses without a lot of resources. So every chapter has objectives. That's obvious. Every chapter has questions. That's obvious, but we've also created a faculty guide, which we'll go into a little bit more depth, that allows you to have activities suggested for both in-person classes and online classes. We have call-outs that hit major points or provide examples or quotes that will highlight what's going on in the reading, because we know textbooks are being skimmed now. They're not read cover to cover like they used to be, and so we want to make this as easy as possible for people to understand key concepts and dive deeper when they need to. We have course guides as well that'll help teach or help support teaching and learning. We have PowerPoints for every chapter, but it goes deeper, and we'll talk a little bit more about it when we talk about the faculty guide. And so there's 4 distinct content sections, and this was really intentional as well because they build over the understanding of these processes together moving forward. So the first section is understanding the context of healthcare, the context of evidence as a foundation, and the context of innovation and innovation leadership. So it's very foundational understanding of what these concepts are, what complex systems are, where we are in the evidence-based practice world, and what are the strengths and limitations of all of that. So the students get a foundation of these concepts. Then we start bringing it together where we talk about supporting innovation through evidence, and we have a few chapters on that, writing business cases and understanding how to apply these concepts in the real world. Once you've applied innovation and evidence, you want to be able to measure it, and so we have some chapters that go into the measurement of innovation. And the measuring of innovation is very hard, so don't think we have some tool that shows you exactly what you have to do to measure innovation, but we have suggestions on pattern recognition, evidence-based practice, adoption, measurement, and some others related to how can you understand if you're moving the dial on your initiatives. And then the final section is a few chapters of real-world application where we use examples from large organizations like Kaiser Permanente in how they took these concepts and applied them to real-world situations. So it allows students to see the synthesis of the concepts and the theory to application. Each chapter has about 3 learning objectives to guide learning. We have multiple in-text activities, again, both focused on online. If you're teaching a fully online course or in-person course, we have different activities for both and suggestions for both of those, and you can combine them in a hybrid format if you're doing a hybrid type course. The faculty guide also, if there's any case study or discussion question, the faculty guide has the context behind why we chose that specific example or that discussion question. So you can see the thinking of the authors in how they wanted to highlight a key point so they can help you focus assignments or discussion around that. We also have additional resources that we're linking. We have TED Talks, we have some YouTube videos that highlight some of the key concepts in a different way, in a more engaging way potentially, with short snippets that highlight synthesis of concepts, usually outside of healthcare, so it allows for a different understanding of the content. So how are we going to use this text? You know, it's really a comprehensive guide for faculty that will help you design courses. We've written a guide for you to design a program, an entire leadership program around this book, or specific coursework. So we've done both. You can also create custom text solutions, which is really great. You can, if you like 3 or 4 of the chapters, you can create an ebook through Jones and Bartlett and just pick those chapters. They don't have to buy the whole book, and we're actually doing that in one of our courses at Ohio State. And really, this is a hub for deeper dives into evidence and innovation. So I'm going to turn this over to Sandra, who can talk more about how this is a hub for learning related to evidence, innovation, and leadership.
Great, thanks, Dan. So just to pick up where you left off, it really is, you know, we wanted to think through the various types of programs that might be out there, you know, conscious of those organizations and schools that maybe are launching a brand new program in leadership and innovation, or also trying to find a place for this type of a text in an existing program. So really wanting to be flexible there. And just some of our thinking in terms of the book itself, because in our first webinar, we did have a lot of questions about, you know, is this the be-all, end-all book that if, you know, we use this, we won't have to have an evidence-based practice book or a leadership book. And what our approach has been is, and as Dan has articulated throughout his comments, is that the nature of this book really is bringing together those disparate worlds that are usually talked about in isolation and looking at the dynamic between them. So it fits very nicely that if you already have an existing leadership book or resources, or you have a favorite innovation text or an existing evidence-based practice text, this book gives you a different way to illuminate for students how those things are dynamic and helps to not oversimplify, but really see how in the real world these things exist together and indeed need to exist together. So just another kind of organizing framework for the text. Dan did a great job of talking about that synergy and the coexistence of and the dynamic of evidence, innovation, and leadership. And the chapters and topics throughout the book are also organized around some themes, if you will, that run through the various chapters that we had our wonderful co-authors contribute, and indeed our own writing. But really those kind of key anchor themes would be exploration of patient-centered and relationship-centered care and what that means for how you work with evidence, innovation, and leadership. The technology piece. Tim Porter-O'Grady did a great chapter for us, particularly looking at failure and reframing failure, you know, from an organizational level and failing forward and learning from that in terms of improving processes and moving innovation, evidence, and leadership forward. Dan also mentioned looking, you know, the whole idea around complex systems and understanding complexity using patterns. And so when we're trying to measure something that's complex, rather than having, as you said, a tick box toolkit or, you know, just do steps 1 through 10 and you'll be golden, it's really about looking at pattern recognition and what those patterns are telling us as a piece of this. And finally, but by no means least, partnerships. Partnerships with, you know, it could be anything from interprofessional practice to partnering with industry. And as Dan mentioned, one of the other non-intuitive, I guess, partnerships is his example in Kaiser, where they're looking at the partnership between labor unions and nursing, for instance, and making that work. The other piece, and this actually, this graphic is from the chapter 16 in the book, I believe, and this is really that idea of the so what and kind of pulling all of those 15 chapters together to say, well, where are we going? How do we put this in a nutshell? And really, what are the competencies for leaders of innovation? Because I guess that's another point to make, is that, you know, there's an awful lot of healthcare leadership literature out there and general leadership writing and research. And leading innovation is a little bit different. And when you add that element of evidence-based practice from a healthcare perspective, it really is its own genre of a different type of leadership than what we might see in industry and healthcare generally. So this is really a niche skill set, but one that is essential in preparing leaders today and leaders in the future to really build evidence-based innovation and have the science and art and nuances all together. So it really begins with, and this was kind of echoed throughout the book as well, you know, it's really understanding that innovation, evidence, leadership dynamic, and that's really what the first section of the book is about, that foundation of how these things interplay. Of course, we can't lead anybody else unless we can lead ourselves and are able to do that in a healthy sort of way. So we have a section there about self-leadership, and that includes self-care and thinking of our leadership practice from a wellness perspective and leading our teams in that same manner. Building innovation competency. So as Dan said, there is a science to innovation, design thinking, and a lot of what we see in industry can be applied to healthcare and indeed should be applied to healthcare, but we need to develop that capacity around innovation that isn't taught to healthcare professionals in a lot of basic programs. So we need to develop that in ourselves and in our teams. And finally, you know, communicating and connecting, it's that synergy, it's not doing things in isolation, but seeking those partners, who else needs to be at the table, and coming up with complex solutions to complex problems. And then building that momentum and using that momentum to drive us forward are really some of the key messages in the wrap-up chapter, but again, built on throughout the book. So Dan already talked quite a bit about the content design. So again, there's call-out chapters in call-out sections in the chapters. Excuse me. They're usually shaded or indicated so that they're easy for you to see there. And those are also represented in the instructor guide or the faculty guide that give you some more details about what are some extending questions that you might ask as the facilitator of learning to really leverage that in-text discussion question or activity. So we've kind of tied those things together so that they're value added. I think Dan covered the rest of that very nicely, so I won't spend a lot of time on that so we can get to questions. So as Dan also mentioned, you know, this is a fairly unique text. There's a lot of things that you won't see anywhere else, and when we were doing the research for it, we looked, so we know that it's not out there. So really, again, that foundation of what is this evidence-based practice plus innovation framework, and how do we cobble those together in a way that makes sense without artificially simplifying things. Chapter 4 is really a great chapter Dan and I co-wrote, looking at patient-centered care as a foundation for innovation and really engaging patients and communities in a different way to drive innovation forward. Chapter 5 is a great chapter that focuses on technology as a source of evidence, and Dan gave some great examples about wearable devices and real-time data. That's included in that chapter. We also have several chapters, and indeed throughout most of the chapters, there is a heavy focus on complex relational healthcare in terms of the human side of complexity. One of the other things that we often see when we try and look at complex system texts is they take a very depersonalized approach to it because it comes from complex systems, but we are humans enacting and living within complex relational organizations, and indeed human relationships are complex in and of themselves beyond kind of a more quantum view. So we kind of grapple with that and how this very human world of healthcare and a very complex world of healthcare needs to be relational, and that ties those two disparate things together. I talked already about the failure chapter as a way to lead change, and also we talked about the labor unions innovation partnership chapter as well. And again, the core content around evidence-based practice and innovation, we have some, I mentioned that innovation leadership is its own kind of type of leadership, and so Dan does a great job of illuminating what those core competencies are and how indeed leading innovation is different from leading status quo or current state, or even something you know, like transactional leadership, which is, you know, a leadership theory that has gone by the wayside, but very different to that. Chapter 9, really looking at some of the foundations and the lived experiences of enacting evidence-based practice through disciplined clinical inquiry as a method for doing that from one of our co-authors. And finally, chapter 14, this was my my labor of love chapter, I guess I can say. Basically, what it was response to is, as you heard in my bio, I am the Associate Dean for Undergraduate Programs in a large university, and there's not a lot of writing out there around how to enact leadership, evidence-based practice, and innovation within our teaching structures and within our organizations that are universities and schools. So that really addresses that and applies those same themes throughout the book to educational processes. So the text differs, as we've shared throughout the program today, is that it's really focusing on that both and thinking, and we're looking at leadership, evidence practice, and innovation. So it's kind of like the both and really getting into and honoring the messiness of that, and finding a way forward to live amongst that. And again, it's from our own experience of having to cobble those things together and really helping students. I mean, it's hard enough for faculty to get our heads around these things and make it work, but for students, it's even more mind-bending. And the other piece of it is that lots of times in our everyday practice within our organizations, we don't see it, right? There are a few shining examples and glimmers here and there, But by and large, what I've heard from students over the years is we're talking about these paradigm-bending ideas and moving to the future and leveraging evidence-based practice for innovation. And they're saying, this isn't my reality. I don't see this. And so it challenges the status quo, and it really encourages this integrative thinking, the big picture versus that oversimplification that we tend to do in educational processes. So you can go to the next slide, Dan. Thanks. So the other thing to be aware of with that is because this text is more on the leading edge than rather talking about current state and what is it actually sometimes makes, and we are glad that it does, but it will make people feel uncomfortable and challenge assumptions and challenge status quo or some of our ways of seeing the world, our paradigms. And as a faculty member and even as a student reading this, you have to be ready for that and engage in those conversations and say, you know what, it's good to be uncomfortable. If you're uncomfortable, you're learning, you're questioning, you're challenging assumptions, you're making space for what might be instead of recreating what is over and over and over again. So I wanted to make that point as well. And so where to use this text is, as Dan talked about, we have talked and tried to be inclusive beyond nursing. So Dan and I are both nurses, but a lot of our co-authors are representative of other disciplines. I know one of the chapters on relational complexity, we have a family and child therapist who contributed to that in his world of providing therapy to his clients. So it's really meant, and our languaging, we try and make it as inclusive as possible, so it's just not nursing specific, it's just not nursing examples. We have examples and data from pharmacy, from public health, from larger organizations that look at healthcare and leadership from a not just one discipline perspective. The other thing that we have done is looked at a competency crosswalk. So if you are planning your program or indeed looking at accreditation standards and whatnot, we have crosswalked the book and the chapters within the book for the AONE competencies so that that's nicely laid out for you. And we are working on other competencies from the educational perspective, so kind of like the graduate I'm trying to think the entry, so not the entry to practice, the graduate competencies and those sorts of things. So those are forthcoming, but the AONE crosswalk is up in the online resources. And as far as teaching tips, I've talked about this already in terms of, it builds on what you may already have, or it's also a great starting point if you're just venturing into developing a course or a program around this type of content, evidence, and innovation and leadership. And as I alluded to, we recognize that there's this gap between what is and where we're going in healthcare. And I think this is why it's so important to integrate this into graduate programs, is so that we can create that future. Because if we don't change what we're teaching and how we're teaching, we're not going to have that long-term impact on changing the practitioners of the future to lead differently and to really engage in leading innovation. So I really see that, education is where it starts, and this is having a different kind of conversation about what can be and what should be with our students. So just to summarize, the case is that the future of healthcare has to embrace the foundational evidence and the true power of innovation. It's a different way of leading. We need change in healthcare, but it needs to be based in sound evidence, and we can springboard from that. And as I said, this text is really challenging a lot of those assumptions that have led to our current state that we don't want to perpetuate. And it proposes a pathway forward for transformation using evidence and leveraging the leadership of innovation. And with that, we're done, and we're happy to answer questions.
Thank you, Sandra and Dan, for a really comprehensive and thorough presentation. That was fantastic. And just to want to remind everyone, if you do happen to have a question, you can message either Aliana or myself using the chat feature within Webex. And we'll also open up the line for questions. And in the meantime, we have received a few questions that have come in, and the first is wanting a little bit more definition around, I think, Dan, when you were speaking about the HCAP scores, do you mind just giving a little definition of that?
Yeah, sorry for the acronym work. So HCAP are basically hospital experience measures from the Center for Medicaid and Medicare Services. They use it it's a survey they send out to inpatient, as well as they have a different survey for outpatient about patient experience. So it asks, was your pain controlled? How was the communication with your nurse? How were you treated? Some questions like that to understand patient experience, and then those scores are actually tied back to some level of reimbursement for services and provide a rating for the hospital that's publicly available. And so it's a huge focus for administrators within the hospital systems. And there's actually some of the HCAP scores are considered nurse-sensitive indicators, where nursing interaction with patients is a majority of what the question's asking about. And so some of this is some of the text and content in this book is how do you create those relationships and how do you lead from a patient experience standpoint. Specifically, I think chapter 4 it is where we talk about patient-centered care as a source of innovation. We kind of dive a little bit deeper into that type of relationship.
Excellent. Thanks, Dan. That was really helpful. Another instructor asked if there were chapters that would discuss integrating behavioral health into a primary care setting.
I'm just looking at the question in the chat, and I don't think we get as specific as talking about integrating behavioral health into primary care settings, but we do talk about primary care settings and specifically the interprofessional teams, and so that could be applied to behavioral health, to chronic disease, what have you, but I think there's enough guidance there to talk about the interprofessional pieces and how you would work with a team to integrate whatever it happens to be. Some chapters that do focus on that, as again, chapter 4 does talk specifically about interprofessional strategies and relationships specific to patient-centered care and relationship-centered care, and that includes the relationship among the professionals on the team as well, and looking at that from a complexity perspective. The other chapter that is helpful there is chapter 10, where there's some examples and again, reframing the relationship aspects of care from a team perspective. So I hope that's helpful.
Yeah, I think the other piece is we may not go specifically into behavioral health as the innovation, but if you look at it as the context of, in certain locales and practice settings, behavioral health hasn't traditionally been in primary care. And if that is the innovation you're trying to lead, there are several chapters that will give you context and skills to lead really any sort of innovation, but you can apply it towards that specific change you want to create. So I would just offer there's several chapters depending on how you want to go about it that could help build capacity and skill sets and leadership competencies around that sort of change.
And I would also say, Dan, I just had an epiphany, that in the chapter about Cincinnati Children's Hospital, they do have a couple of case studies that specifically look at behavioral health in Cincinnati Children's and how they've made some innovations around that in terms of early access and linking from acute care to the primary care setting. So there is a little bit of content there, but again, it's about, the strategies for building the business case for that type of innovation would be really good.
Thanks, Sandra. Thanks, Dan. We do have a few more questions via chat. Someone is asking if there are any competency, crosswalks for the MSN Essentials.
That's what I was trying to say, and I stumbled over it, so I apologize. Yes, that's the one that I'm currently working on.
Excellent. Another question, and I know, Sandra and Dan, that you did cover this in a few different slides, but where, you have had clinical experience in, where you're also, currently faculty members, what other tips could you offer the audience today for integrating, this text into an existing high-level leadership course from your maybe own personal experience?
That's a great question.
Yeah, I mean, for me, we just got approval like 2 days ago for the Masters in Healthcare Innovation program at Ohio State, and that program is very focused on the foundations of leadership across the entire curriculum. And this book is actually, we're using it as a great, it's in their first semester, and it gives a great context and prep for the concepts of leadership, organizational culture, innovation, complex systems, because, while it does dive deep to some level, it's not a comprehensive text for any of that. But it's laid out in a way that allows you to understand the concepts and their application to the real world, and it sets the stage for students to move forward into deeper texts like quantum leadership or, a complexity science textbook or something like that, or a deep evidence-based practice, how-to book as well. So we're using it in our evidence-based practice for innovation course as a foundation, and the students are moving through that. I would also say we're using it in our general Master's in Nursing class as well, specifically the accelerated program, the second degree nursing program, where this is, some of the chapters are being used out of this text in their general leadership course to provide some highlights around the AONE competencies which the course is designed after. So those are just two examples.
Mm-hmm. Thanks, Dan. And I'm just looking at some other questions that may be a little bit related. Some people are asking about DNP programs and whether this book would be useful. Absolutely. I think it fits really well with DNP programs, particularly because it has a nice balance of the kind of the science and the evidence and the foundational concepts and the theory, but then also that's brought to life with these really rich examples of the clinical world. I believe
Arizona State is using it in their DNP program as well as, I know Arizona State is because I had a friend text me chapter 2 and say, look, I'm reading your chapter in our DNP program. So I know they're using it at least a few schools.
Yes, indeed, and I think it's a great fit, but also for a larger gamut and range of graduate level study. And another question is about the AACN DNP scholarly project application for evidence. I think that is a perfect fit, and this book would provide a lot of guidance in terms of faculty, or students developing those types of application projects. So I think that would be very useful and provide a scaffold for people to really think through projects that are going to be meaningful and take them forward. I also echo Dan's comments in terms of looking at the use of the text in undergraduate education. I think second degree or after degree students that have some foundation chapters will resonate with them depending on what you're teaching. I do think if it were a standard baccalaureate course where you're getting students directly from high school and it's their first university experience, it may be a little bit high level, but that's not to say that again, you could look at specific chapters that would really kind of resonate and build that picture of what nursing and healthcare is moving towards. So I think that would be a good fit for the build your own textbook with several chapters with what Jones and Bartlett offers.
Just real quickly, I'm trying to also get this, at least some of the concepts and chapters of this into a new medical school curriculum as well that I'm working on as the foundation for interprofessional practice discussions and leading teams forward. So that's another application. So remember, there's very little nursing specific examples. While they do exist within the book, we tried to write this for healthcare in general because interprofessional practice is where we're moving. Team leadership it trumps any sort of individual leadership, and so there's lots of applications outside of nursing as well.
Mm-hmm. And I remembered what I was going to say. In response to, there's a question about a faculty member who's currently using quantum leadership and that the students are having a hard time with it. I think a strategy would be, as Dan suggested in his earlier remarks, really starting with evidence-based innovation would give a foundation that would maybe make it easier for them to then do the deep dive into quantum leadership. Being very familiar with quantum leadership and using it in the past, I know it is a little bit mind-bending for students, and some of the language is a bit dense, which is part of what's great about it because it really makes you think. And, you know, the students have shared, you know, you reread it 3 times and then you finally get it, which is that great depth. But in terms of getting them closer to being able to engage it in a meaningful way, I think evidence-based innovation might be a way to start to make it easier for them to understand where quantum is going.
Yeah, that's exactly why we use this text in the accelerated program, is because this one has a little bit more application, and then they can dive deeper into quantum at a more advanced leadership class.
Yeah, agreed.
Great. Dan, if you wouldn't mind flipping to the next slide, that just has some information about how the faculty can request a review copy. Great. So if you visit go.jblearning.com, and that's /LEBI, that will bring you to the product page where you can find out a little bit more about the text. You can also click the instructor review copy button. That will enable you to get a review copy, and that will send information directly to the account manager in that territory. I think we also had a couple questions asking about how you can review the faculty guides, I think that Sandra was talking about. You can do that by going to the Instructor Resources tab that's listed on that product page as well, and you just want to hit that Click Access or Request Access button. Sandra and Dan have been kind enough to put out their contact information. If you do have any questions, please feel free to reach out to them. And then I know during the presentation we also talked about making this a custom textbook. So we have a custom solution manager. His name is Dan Sowers, and he can be reached at the email address provided there. He's very excited to be working on all of these kind of custom initiatives. So if you have any questions at all, he's happy to sit down and have a consultation with you. At this point in time, we don't necessarily have any more questions, and I do want to thank everyone for joining us. Stay tuned for a follow-up email that will tell you where the webinar will be posted on our YouTube channel. And I want to extend a very big and warm thank you to Sandra and Dan for their time today.